Hi, today I'm talking with Dr. Tom from NatroNet. Our topic today is chemotherapy and radiation. Now, many patients who are undergoing cancer treatment are receiving chemotherapy and or radiation. Do you have any recommendations for them on what they should be doing while they're in treatment?
This, to some degree, may be somewhat of a controversial topic. There are many oncologists who believe that if their patient is undergoing either of those therapies, that they shouldn't be doing anything else because their belief is that it will somehow reduce the effectiveness of the treatment of what those therapies are going to be doing. However, on the other side of the coin, there's an awful lot of research which shows improved outcomes when people indeed do supportive therapies while the patient is undergoing those types of treatments. So, yes, what I have done for many people using research to show that the use of antioxidant support, whether it's in a vitamin and type pill, or more importantly, their diet, which is critical for what's going on. We give very specific dietary suggestions, which is different, a little bit different than just the generic aspect for diet, but there's some specific suggestions that can be done to try and minimize some of the side effects that patients will get when undergoing those types of treatments. There's a lot of things that can be done both before the chemo or radiation treatment and after the chemo and radiation treatment, which will also significantly reduce, the potential problems. And it's our belief that one of the biggest challenges and the reason that people get a lot of, unpleasant side effects is because the body doesn't have the ability to eliminate all the broken down tissues that the cancer, the chemotherapy or radiation is causing. It's sort of like exploding all these cells, and then all this debris is just sort of gets accumulated and needs to be eliminated from the body. So we need to absolutely ensure that the person has their ways of removing waste products from their body working optimally. We need to know that the nutrition that they're getting is optimal for them specifically. There's a number of supportive therapies that can be done in addition to that. So people who are undergoing these treatments, for all intents and purposes, don't have to suffer as much as they do, especially as the number of treatments go on, because as the medication accumulates in tissues, by the time a person has had their fourth or sixth treatment of chemo, they often are not feeling well. They may be able to tolerate the first few, but so we needed to be doing things starting even before the first treatment to really optimize their ability to recover. And one can certainly look for ways to certainly help that. And there's many positive things which will then improve the overall outcome for the patient, which we're all interested in.
Great. Thanks, Dr. Tom.
You're welcome.